If you've been tired for months and every basic blood panel keeps coming back normal, there's a real chance the test that actually explains it was never ordered in the first place. Not because your doctor is careless, but because standard panels are built around cost and general population screening, not around the specific things that go wrong with aging bodies. Today, I want to walk you through the tests that get skipped most often after 60, why they get skipped, and exactly what to ask for at your next appointment. This channel is about translating real research into information you can actually use, without the fear-mongering and without the miracle cure sales pitch. If that's useful to you, subscribe, because we cover something like this every week. Let's start with why this happens in the first place. A standard annual blood panel, the one most people get, usually covers a complete blood count, a metabolic panel for kidney and liver function, and sometimes a basic lipid panel. That's a reasonable baseline. But it was never designed to catch the specific things that quietly drain energy in people over 60. Those require tests your doctor has to specifically think to order, and in a 15-minute appointment focused on blood pressure, cholesterol, and whatever brought you in that day, fatigue often gets chalked up to getting older, rather than investigated further. Here's the first one, and it's the single most commonly missed test in this age group, ferritin, which measures your iron stores. Most people assume iron deficiency is something that only affects young women, typically related to menstruation. That assumption causes real problems in older adults, because iron deficiency in seniors is actually common and frequently missed. A standard complete blood count can look completely normal. Your hemoglobin can sit right in range, while your ferritin, the marker that shows your actual iron reserves, is quietly depleted. Research published in the journal Blood has shown that iron deficiency without full-blown anemia is associated with fatigue, reduced exercise tolerance, and cognitive symptoms, even when standard blood counts look unremarkable. In older adults specifically, low-grade chronic blood loss from the GI tract, poor absorption due to reduced stomach acid, or long-term use of certain medications can all drain iron stores gradually, without ever showing up as anemia on a routine panel. The reason this test gets skipped is simple. Ferritin isn't part of a standard metabolic panel or complete blood count. It has to be specifically requested. If you've never had this test and you're dealing with unexplained fatigue, it's worth asking for by name. The second test that gets missed constantly is a full thyroid panel. And I want to be specific here, because this is where a lot of confusion happens. Many people believe their thyroid has been checked because their doctor ordered a TSH, thyroid-stimulating hormone. TSH is a reasonable starting point, but it's an indirect marker. It measures a signal from your pituitary gland, not your actual thyroid hormone levels. In a meaningful number of people, particularly older adults, TSH can sit within a normal range, while free T4 and free T3, the actual active thyroid hormones, are on the low end, or the conversion between them is impaired. A 2019 review in the Journal of Clinical Endocrinology and Metabolism described how subclinical thyroid dysfunction becomes more prevalent with age and is frequently underrecognized because clinicians rely on TSH alone. Thyroid hormone affects metabolism, temperature regulation, muscle function, and energy production at the cellular level, so even a mild dysfunction can produce fatigue, brain fog, cold intolerance, and weight changes that get attributed to normal aging. If you've only ever had a TSH checked, ask specifically whether free T4 and free T3 can be added. The third one surprises almost everyone, vitamin B12, and specifically, the way it's often tested incompletely. Standard B12 testing measures the total amount circulating in your blood. The problem is that a meaningful portion of people, especially those over 60, can have B12 levels that look adequate on a standard test while functionally being deficient at the cellular level. This happens because B12 needs to be converted to an active, usable form, and aging reduces stomach acid production, which is essential for absorbing B12 from food in the first place. Long-term use of certain very common medications, including acid reducers and metformin, further reduces absorption. A study in JAMA has documented that B12 deficiency affects a substantial percentage of adults over 60, and that standard testing alone can miss functional deficiency. When it's suspected but the standard test looks borderline, doctors can order additional markers, methylmalonic acid and homocysteine, which are more sensitive indicators of whether B12 is actually being used properly at the cellular level. B12 deficiency left unaddressed can cause fatigue, numbness, and tingling in the hands and feet, memory problems, and in advanced cases, irreversible nerve damage, which is exactly why catching it early matters. The fourth test is vitamin D, and while this one does get ordered more often than the others, it's frequently ordered once and never rechecked. Vitamin D isn't just about bone health. It plays a role in immune function, muscle strength, and mood regulation, and deficiency has been consistently linked in research to fatigue and generalized muscle weakness in older adults. Skin becomes less efficient at producing vitamin D from sunlight as we age. Kidney function changes affect how the body activates it, and many people simply spend less time outdoors than they did decades earlier. If your vitamin D was checked years ago and never since, that single data point may not reflect where you are now. The fifth is hemoglobin A1C, and this one matters because of how gradual the problem it detects can be. A single fasting glucose reading captures a snapshot. A1C reflects your average blood sugar over roughly 3 months, which makes it far better at catching the slow drift toward insulin resistance that can happen years before someone meets the technical criteria for diabetes. Fatigue, especially the kind that shows up after meals, is a common early symptom of blood sugar dysregulation, and it's frequently dismissed because a single fasting glucose test still falls within a normal range even as A1C is trending upward. The CDC has noted that roughly 1 in 3 adults with prediabetes in the United States doesn't know they have it, and that number is not smaller in older adults. If it's been more than a year since your last A1C, it's a reasonable thing to ask for. Now, here's what I want you to actually do with this information, because a list of test names isn't useful unless you know how to act on it. Step 1. Write down your actual symptoms specifically, not just "I'm tired." Are you tired all day, or is it worse in the afternoon? Is it accompanied by cold intolerance, hair thinning, or dry skin, numbness or tingling anywhere, brain fog specifically, versus general low energy, weight change in either direction? These details genuinely help a doctor figure out which of these 5 tests, if any, is worth prioritizing, rather than ordering all of them reflexively. Step 2. Bring a specific, written list of the 5 tests to your appointment. Ferritin, free T4 and free T3, in addition to TSH. B12, with methylmalonic acid and homocysteine if B12 comes back borderline. Vitamin D, if it hasn't been checked in the past year or 2. Hemoglobin A1C, if it hasn't been checked recently. Having this written down, rather than describing vague fatigue, tends to lead to a much more productive 15-minute visit, because you're handing your doctor a concrete plan rather than an open-ended complaint. Step 3. Ask specifically whether any current medications you take could be affecting absorption of these nutrients. Long-term acid reducers, certain diabetes medications, and some others are well documented to interfere with B12 and other nutrient absorption over time. This isn't about stopping anything on your own. It's about your doctor having the full picture when interpreting your results. Step 4. If a deficiency is identified, ask what the follow-up testing timeline looks like. Correcting a nutrient deficiency isn't usually instant, and knowing when to expect a recheck helps you understand whether a given approach is actually working rather than guessing. Step 5. Keep a simple 2-week log before your appointment. Your energy level on a 1 to 10 scale each day, roughly what and when you're eating, and your sleep. This isn't about diagnosing yourself. It's about giving your doctor pattern data instead of a single subjective impression, which makes it much easier to connect your symptoms to what the blood work eventually shows. One important thing before we close. Fatigue in someone over 60 can have a lot of causes beyond what we've covered today. Cardiovascular issues, sleep apnea, depression, medication side effects, and others. These 5 tests are commonly missed and worth asking about, but they're not the only possible explanation, and they're not a substitute for your doctor's full evaluation. If your fatigue is severe, sudden in onset, or paired with chest pain, shortness of breath, or other concerning symptoms, that warrants prompt medical attention rather than waiting for routine blood work. The bigger point here is this. Normal blood work often means normal for the tests that were run, not necessarily a complete picture. Standard panels are built for general screening, and genuinely useful markers for fatigue in older adults often require you to ask for them by name. You now know which ones, and you know exactly what to bring to your next appointment. If this was useful, let me know in the comments which of these 5 tests you've actually had done, and which ones you're going to ask about. And if you know someone who's been told their fatigue is just aging without a real explanation, send this to them. It might be the thing that finally gets them a useful answer. Subscribe if you want more of this kind of research broken down clearly, because next week we're covering why balance gets worse after 65, and the simple test that can reveal your fall risk before it becomes a real problem. Take care of yourself,